Septic arthritis demands urgent medical intervention due to its severity and potential life-threatening consequences. This condition entails an acute infection within a joint, frequently triggered by bacteria like Neisseria gonorrhoeae or Staphylococcus aureus. Patients commonly exhibit intense joint pain, swelling, warmth, and fever, necessitating immediate diagnosis and treatment to avert permanent joint damage or systemic complications. The classic case, septic arthritis predominantly affects young, sexually active individuals, often caused by Neisseria gonorrhoeae. This scenario represents the classic presentation frequently encountered in medical exams. Atypical presentations. Elderly individuals and those with underlying conditions may exhibit atypical symptoms, such as the absence of fever or infection with different bacteria like E. coli. Staphylococcus aureus is another common offender, particularly in individuals with compromised joints, artificial joints, or a history of intravenous drug use. Diagnostic clues. Although elevated inflammatory markers like ESR and CRP may be observed, they lack specificity for diagnosing septic arthritis. The definitive diagnostic approach involves joint aspiration and synovial fluid analysis, which can unveil elevated white blood cell counts, bacterial presence, and the absence of crystals associated with other inflammatory conditions. Immediate joint aspiration. The first crucial step in managing suspected septic arthritis is performing an arthrocentesis to obtain and analyze the synovial fluid. This not only confirms the diagnosis but also relieves symptoms by alleviating joint pressure and inflammation. Antibiotic therapy. Initiating intravenous antibiotic therapy promptly, such as ceftriaxone and/or vancomycin, is vital to target the causative bacteria and control the infection. Continuous monitoring and adjustment of the antibiotic regimen may be necessary based on the synovial fluid analysis results. Orthopedic consultation. Given the potential for rapid joint destruction and the potential need for surgical intervention, an immediate orthopedic surgery consultation should be sought. The surgeon can offer further insights into the necessity for joint irrigation, debridement, or other interventions to manage septic arthritis. Analyzing synovial fluid plays a pivotal role in distinguishing septic arthritis from other inflammatory conditions like gout and pseudogout. In septic arthritis, the synovial fluid often exhibits a white blood cell count exceeding 50,000 cells, whereas crystal-induced arthropathies usually display counts below this threshold. Identifying crystal types. Through polarized light microscopy of synovial fluid, uric acid crystals in gout or calcium pyrophosphate crystals in pseudogout can be detected. This microscopic examination aids in differentiating these conditions from septic arthritis, where crystal presence is typically absent. Radiographic assistance radiographic imaging, such as plain films, serves to exclude alternative diagnoses like osteomyelitis, which may manifest similarly in the joints. Distinctive radiographic signs such as periosteal reaction and soft tissue swelling can bolster the diagnosis of septic arthritis. Joint aspiration for relief. Joint aspiration not only aids in diagnosis but also offers immediate relief from the intense joint pain characteristic of septic arthritis. By reducing joint pressure and inflammation, this procedure can significantly alleviate the patient's discomfort. Pharmacological intervention. Intravenous morphine administration is crucial for effective pain management in septic arthritis cases. Other pain medications may prove less effective, but the ongoing antibiotic therapy and joint immobilization further contribute to pain relief. Orthopedic intervention. Persistent pain, swelling, or warmth may necessitate additional interventions by the orthopedic surgeon. Joint irrigation and debridement may be required to ensure adequate infection control and symptom alleviation. Ensuring patient safety. Before undertaking any invasive procedures like arthrocentesis, it's paramount to assess the patient's coagulation status. Ordering baseline PT/PTT tests helps mitigate the risk of bleeding complications during the procedure. Anticipating needs. To preempt any unforeseen circumstances, it's wise to order a blood type and cross-match. This preparation ensures readiness for potential blood product administration or transfusion during the course of treating septic arthritis. Comprehensive assessment. In tandem with synovial fluid analysis, a thorough laboratory workup is essential. A complete blood count, basic metabolic panel, and blood cultures furnish critical data guiding septic arthritis management. Diagnostic imaging. To rule out alternative diagnoses like osteomyelitis and evaluate for structural changes warranting surgical intervention, obtaining plain radiographs of the affected joint is imperative.